for joining our first webinar of the year, Make Way for Gateway with House Calls Pro for Epic. In this webinar, we're really going to focus on our Gateway product and how we can provide different notifications to you utilizing your Epic system for event triggers that then send these messages out. Okay, so today we have myself. I am a Senior Product Manager for Intrado. I'll be going through some of the different examples of gateway messages that we have and have configured for some of our customers. And then we also have Dan Jashinsky. He is currently an Intrado BFF, so some of you may have already worked with him. He's a great resource, but he likes to assist our customers with more specific Epic configurations and trying to help make sure that your organization is working in the best way possible. And he is a prior Epic Cadence analyst and an App Orchard TS, so we're very thankful to have him as a part of the Intrado team. For our agenda today, we are going to cover an introduction to the Gateway product just to make sure you guys are all a little bit more aware of what it is, specifically some of the use cases that we've handled, as well as sharing a customer story of someone that has recently implemented the Gateway product and the success that they've seen with that. And then lastly, we're going to open it up for Q&A. I'll go ahead and pass it over to Dan. Dan, if you want to go ahead and begin.
Yeah, definitely. Thanks, Tabitha. So this morning we are talking about what the House Calls Pro Gateway is. And some of you who work with Epic have probably heard it referred to as like the SMS gateway or the Epic SMS gateway. Essentially, Intrado is filling that gap in Epic functionality where Epic does not support SMS natively. So with the House Calls Pro gateway, we function as basically the connecting API that allows Epic to transmit those SMS messages to your patients. So essentially, the content for the message is generated in Epic that is transmitted to Gateway via an API. And then we take care of the process of transmitting that message to the patient. Okay, and for Gateway setup, it's a relatively straightforward process. There are a couple teams that you'll need to involve. Obviously, you'll need your Cadence team involved. You'll probably want your Epic Cadence TS as well. Potentially also your MyChart TS, depending on the scope of what it is you're looking to accomplish with Gateway. You'll want some of your Intrado representatives as well, probably your AM, possibly the BFF. And then you'll also need interconnect involvement as well. Someone who has access to the specific record type. It's an E0A record, if that helps. So if you're talking with your interconnect team, you just need someone who has the ability to create and modify E0A records. Those are external endpoint records. And then as far as the build steps are concerned, Intrado actually has an implementation guide published to Galaxy. So if you search for Intrado implementation guide, you should be able to find ours out there. It has a lot of the steps outlined for you. So the first couple are on the interconnect side. You need to create your interconnect queue for SMS, which you may already have in place, but that's something that you can check. You'll also have to assign listeners to that queue, but that's part of the initial queue setup. So if it's already set up, that may be a step you can skip. Then you'll create the actual E0A record where you will plug in Intrado's endpoint, which is ultimately what you'll hit when you generate those messages out of Epic. And then you'll just be plugging that record into various system settings, either in the service area or at the system level. I believe that lives in the MyChart system desk in WDF, but you'll plug that in, and then those messages should be coming to us to transmit to the patients. And at the bottom, it says it typically takes about 30 minutes of hands-on keyboard to implement. That's pretty accurate. The hardest part generally is getting the right teams together to make sure everyone knows what's going on and knows what they need to do. So as long as you have all the folks you need, it's pretty quick turnaround time to get this set up.
We want to go ahead and talk about some of the different use cases that we have Again, these are event triggers within Epic, so they're being sent automatically based off of, different situations that you have set up to trigger notifications and what those messages would say. So this first example is one that's triggered by your Cadence scheduling system. It's just a quick reminder to the patient, letting them know 2 hours prior to the appointment time that they have an appointment that day. This is just, one of the examples that can be triggered from Cadence. Another common one that we see our customers utilize is MyChart, where they're wanting to really encourage patients to use that patient portal. So there's a number of different scenarios that we've seen these MyChart notifications be sent. Specifically, we have activation. So initially, we would want to send out messages to your patients and let them know that we want them to download the MyChart app. And then secondly, we kind of more recently have started seeing a lot more two-factor authentication across a variety of different platforms. So this is something that is also supported by MyChart, and we have started to see our customers want to be able to send out these two-factor authentication messages so that their patients logging into MyChart can be verified with their identity. And then another situation that we typically see are status updates. So in this example, you see there's new test results available so that the patient can easily go in, click that link, and learn what their specific test results were, versus having to call your office and consume some of your time in that aspect. As well as there's other, status updates we can do, like an after visit summary or different situations like that. The next one is triggered by off time. So this is typically utilized for, surgical patients and loved ones to be able to provide information about the patient that's in surgery. Again, these are automatic and triggered on their own, so we can notify the patient or their loved ones that surgery has started, the patient's in recovery, different information that you want to provide to those specific recipients. The next one that we commonly see are balance reminders. So in this case, it's triggered by professional billing, but there's different scenarios that we've seen here. We can do payment receipts or let them know that they have a balance that needs to be paid, as well as sending that them to a MyChart link to pay that balance, what have you. There's different configurations that you can do and different messages that you could send out related to your balance reminders. This next one is pretty neat. We're able to add a button in Hyperspace to be able to allow you to use user intervention, in this case within Epic, to be able to send specific messages to specific patients. So let's say there's an unexpected schedule change. We know stuff like that happens, especially with weather and other circumstances. But if you needed to specifically tell a patient that you're going to be closed for that day, we could embed a button on your Hyperspace screen so that you would be able to click, send office closure, and it would automatically fire off a message that you have, identified and written out to your liking to those specific patients, as well as delays in service is another common one that we see, where you want to just let them know that the provider is running late, but really just making sure that we're able to kind of fulfill the needs that you have here and work with you to set up individual buttons to trigger off these messages versus an automatic trigger that we've seen in some of the other prior use cases through the different systems like Cadence and Optime and things of that nature. Again, I wanted to point out some additional use cases. So we've kind of talked through some of the use cases that are most commonly seen. But again, we have a number of customers utilizing this House Calls Pro feature, and we want to really highlight some of the other ways that our customers are thinking outside of the box when sending these notifications. So you'll see in this list, there's a number of different ways that they're sending out different notifications, like thank you surveys, virtual visit, e-check-ins, obviously a lot of different messages around COVID-19, different vaccines or test results, things of that nature. but even letting them know that the care team is ready, that, they've arrived at the clinic and we want to go ahead and, allow them to come into the office. However, your organization has kind of set up policies for admittance and things like that, to be able to make sure that we're, adhering to the different policies and preferences for your organization. These are just some of the specific examples that we've seen that we wanted to call out. And Dan, I wanted to provide a chance if you had any additional ones that you've seen or any other feedback you want to provide to this particular slide, I'd love to hear it.
So yeah, I mean, there are additional ways that you can customize within Epic to generate these types of messages. I spent a bit of time working with Johns Hopkins when I was at Epic, and they were utilizing some probably more cutting edge features in Epic to send out additional types of messages. Really, it'll be up to you to work with your counterparts at Epic to come up with other ways that you could potentially use Gateway to get in contact with those patients.
Lastly, I just wanted to call out a specific customer that has kind of recently gone live with their Gateway product, Mary Washington Hospital. We've been very happy to work with them, but I wanted to, really provide some statistics showing you the usage that they've seen, and the, value that they've had in the product. So just since the beginning of this year, 25 days, they've delivered over 205,000 text messages related to Epic events and Gateway. And I did provide kind of a breakout on the right side where you can see some of the specific messages that they are sending, just to kind of get an idea of different ways that you could utilize this Gateway product to also trigger different messages for your organization. So again, a lot are specific around MyChart. There's visit summaries, two-factor authentication, test results, surgery updates. A lot of these we kind of talked about already. And then, like I called out earlier, you have online check-in, arrival instructions, payment receipts, different ways that they've been able to implement this product to fit the needs for their organization. So with that said, we are finished with the content part of this piece, but we'd be happy to answer any specific questions that you guys have. You should be able to access the chat bar and put in different chats. I apologize for not saying initially, yes, the session has been recorded and we will be sending out the link afterwards to all of the registrants. So if you were a little late joining in, we'll certainly make sure that you guys are able to access the presentation afterwards. I see a question from a customer that's already utilizing Smart Text RT, and they're wanting to know the benefits of transitioning to Gateway. I think that's a specific one. I'll make sure that we reach out to you directly with your account manager, I apologize, to make sure that they're able to express the specific benefits of that so that you can, make that decision what's best for your organization. Can patients opt out of Gateway? That is, yes, it is configured to be able to support that different functionality that you have. So if a patient does want to no longer receive those messages, they can opt out of that. And then for any additional messages coming out through that number, they would no longer receive those. Provide more information on the weather closure messages you can access and send from a button. Dan, do you have any specific insight on how they're setting up the buttons within Epic to be able to answer that question further?
Yeah, so and I see quite a few of these questions are about like content of messages and what Epic is able to do with the Gateway platform. Those are going to be customizable within Epic itself. So the Gateway product that House Calls Pro offers acts basically like an intermediary between Epic and the patient. So a lot of the content is going to come from what you have set up in Epic. For the weather reminders, things like that, I know Cadence has functionality for like quick reminders are one of the things that you could potentially use to do something like that. Another one, I think it's newer functionality, but it's like clinic closure messaging or something like that. And that's one where you can send out messages in bulk to appointments. I think there's a button on the DAR toolbar that would allow you to do that. So you can multi-select patients and then send that message out. Say a storm is coming and providers are running late. You could just bulk send a message to those patients that you're running about 30 minutes behind. And I see, yeah, there's some in the chat. There's Nova Notes being referenced. So a lot of the content type questions are going to come from Epic itself. So if you have questions about like what types of messages can be transmitted from, say, Grand Central when a patient is discharged, that might be a good question to take back to your Grand Central TS and ask them what type of capability Epic has there. Good question from Jennifer about two-way SMS. That is not something that Epic supports today, but Intrado is working with Epic on developing an API to enable two-way SMS. I know that's been a request from a lot of organizations to have the patient be able to reply to those messages. So that is not something that is possible today, but it's something that we are actively working on, and we are working with Epic because ultimately we'll need to rely on APIs from Epic to enable that type of functionality. But really good question, something we see very often.
Yeah, and there was another question about only able to send as a text. That would be a yes. It's only SMS messages that would be delivered.
Correct. That gives us an opportunity to plug our broadcast portal as a potential alternative. So Gateway is more meant to be content generated from Epic based on some trigger within Epic. So if something happens in Epic, we generate an SMS to the patient. Using House Calls Pro, the broadcast portal, you are able to pull a list of patients from Epic, and you can bulk send SMS or voice messages from that portal. So that's kind of diverting into another different topic, but it is something that House Calls Pro can do. It just would not function through the Gateway portal.
Thanks for that, Dan. Mm-hmm. Another question was, how do they opt out? That would just be replying stop standard. You can make sure that when you send a welcome message to those patients, they would know how to opt out. That's pretty straightforward. And let's see, I know there's a couple other questions we haven't been able to get to, but we'll certainly look through those and make sure that we can answer those to the best of our ability and reach out to the individual askers, as well as if it's beneficial to everybody, make sure that we send that out as well. And I want to go ahead and thank Dan because this is one of the things I wanted to call out too, is that we are going to be doing an upcoming webinar highlighting the new functionality that he mentioned, being able to support the two-way messaging. So this is likely a webinar that will be happening in early March. So kind of, check your inbox and talk to your account managers about that so that you can make sure that you're registered. But this would be new functionality, allowing a lot more flexibility for you and your patients when it comes to Gateway, and getting kind of a two-way response back from patients to be able to help alleviate any concerns that you have with your organization. Dan, is there anything else you want to add?
I did see one other question come in right now about replying stop in the text message, whether or not it updates the patient's communication preferences record. Today, it does not. Gateway is one-way communication to the patient. It's very possible in the future with the development that Epic is working on that the two-way component will allow us to update the communication preferences when the patient opts out. But today it is just a one-way feed to the patient. I've actually one more plug to everyone on the call. I know updating communication preferences is a pain point right now with a lot of this type of functionality with SMS and like reminder calls specifically. This is my plug to all of you to talk with your TS and try to get some traction on having Epic develop ways that would make updating patient communication preferences easier. I know based on my experiences working at Epic, there were definitely enhancement requests out there to add that functionality. So this is my plug to you to go out and talk with your TS and try and get them to develop that stuff, because I think it would help all of us.
Great. Well, thanks everyone for your time. Like I said, we will be sending out the recording. We hope this was beneficial. Again, reach out to us if you have any specific questions, or reach out to your account management team so that they can help you learn more about this product. And we look forward to seeing you at our next product webinar. Thanks.